Hello, this is Dr. Danielle with another episode of Do It Yourself Health, a webinar series I started to empower you to take better control over your health. Today we're going to talk about physician and naturopath. So let me get to my PowerPoint presentation. As you know, I love PowerPoint because you can have pictures, and pictures are worth 1,000 words. So the series Do It Yourself Health, physician or naturopath, who should you work with? Well, it all depends on the circumstances. Let's talk about the medical doctor. We all know what a medical doctor is. They have extensive studies in anatomy, physiology, pathology, chemistry, biology, and all kinds of other sciences. And they can diagnose and treat diseases. That's why they are paid by insurances. An insurance wants a diagnostic before it will pay. They learn how to fight invading germs with pharmaceutical drugs. And they use radiation and surgeries as well. Their association is usually the American Medical Association in the United States. So in a population where 80% of people got the flu, the medical doctor will have studied the germs that cause the problem, the progression of the disease, and how to fight it with pharmaceuticals. It is a war, germs against pharmaceuticals. Don't be surprised if they don't talk to you about lifestyle. That's not what they trained in. Many of my clients are surprised that the doctor doesn't talk to them about food and exercise. That's not what they trained in. They are trained in pharmaceuticals, what drugs to fight what the germs, and give you shots, and they can do surgeries. And for instance, if you have a shoulder problem, they will give you some drugs that will alleviate the pain, maybe a cortisone shot, or maybe do some surgeries. They're not going to talk to you about food that maybe you're sensitive to some food that can swell up the parts in your joint and hurt you. They have not studied that. They're not going to tell you to walk barefoot in the grass in the morning because they have not studied that. I learned that when I was in my teens from a German medical doctor who told his patients in the morning, go barefoot, walk in the grass. And many of them had amazing recovery. There's a lot of antioxidant doing that. So let's talk about the naturopathic doctor or physician. And it's kind of confusing because NDs sometimes have a medical background, sometimes they don't. They're also called NMDs, naturopathic medical doctors, and they have the same medical background as an MD, so they can diagnose and insurance will pay for their care for you. They use allopathic drugs and practice minor surgeries and obstetrics. But they also learn to fight germs with natural means, such as herbs and homeopathy. Their association is the AANP, the American Association of Naturopathic Physicians. So in our population, where 80% of the people got the flu, the NMD will have studied the germs that cause the problem, the progression of the disease, and how to fight it with chemical or natural remedies. But it is still a war. Now let's talk about the traditional doctor of naturopathy. They usually come from a different background because of personal challenges, for instance. That's why I became a naturopath, because I was bedridden and nobody could figure out what to do for me. I had the opportunity because I already had studied in Europe to become a doctor of naturopathy, and I jumped on the opportunity. So we also studied anatomy, physiology, chemistry, biology, not quite as extensively as a medical doctor, though. Our focus is more on how to keep the body healthy and the immune system strong so that invading germs do not get a foothold. We want to stop them before a war needs to start. And we use all kinds of non-invasive therapies such as nutritional and lifestyle counseling. So we work with clients in a holistic way, body, mind, soul, spirit. Physical is important, but also the emotional, the mental, and the spiritual. We address stress and lifestyle, which are often the root cause of many diseases. We don't prescribe any pharmaceutical or perform surgeries. And our association is usually the ANMA, the American Naturopathic Medical Association. Here you have 10 of the most common complementary and alternative therapies that you can find in the United States. Natural products, you can find them in a health food store or order them online. Be careful, many of them are not the best quality. Choose a very good quality. Deep breathing is important. It alkalizes your body. Meditation is one of the best things you can do. It calms you from stress. Chiropractic and osteopathic adjustment, massages, yoga, diet-based therapy. I do what is called food therapy. Guided imagery. My form of guided imagery is called interactive guided imagery. It's a type of client-centered hypnosis that helps a client go very quickly to the root cause of the problem, bring it from the subconscious to the conscious so it can be dealt with. And homeopathic treatment. I do offer homeopathic support for many conditions. So traditional naturopaths use nutrition, herbal medicine, physical therapy, homeopathy, behavioral modification. We also have extensive studies, as I mentioned, and we call the general practitioner of complementary and alternative modalities, many different modalities. So we learn some basics, and then each of us specialize in something that we are more attracted to. In the yoga, I don't do acupuncture, I do acupressure, diet therapy, I mentioned I do food therapy, Reiki of quantum energies, massage therapy, chromotherapy, it's about color, there is also sound healing, meditation, herbal medicine, homeopathy, hypnosis, aromatherapy, Ayurveda, is a medicine that comes from India. There's also Chinese medicine. So, doctor of naturopathy don't diagnose, don't prescribe, don't prevent, don't treat, don't cure any diseases. Therefore, there is no diagnostic, so we are not paid by insurances. But our focus, our main goal is to maintain or restore health naturally. So again, in that population where 80% of the people got the flu, the ND will have studied the 20% who did not get the flu and take the result of this observation to help others not get it. The ND will also study how people got the flu and recovered naturally. And you can read many articles about the subject on my website, daniellepre.com. Under articles and blog, I have a whole series of articles going deeper into the difference between allopath and naturopath, and also on our next subject, Pasteur versus Deschamps. You probably heard about Pasteur, you know about pasteurized milk. Pasteur really promoted vaccination and a fight against germs. At the same time, Antoine Deschamps was also living and doing research there, but he said, keep the terrain clean and the immune system strong, and you won't have to fight germs. Well, on his deathbed, Pasteur eventually said, yeah, Deschamps was right. And years after his death, they found his laboratory studies. He made very meticulous notes about all his experiments, and surprisingly, his notes were not what he was talking about in the general public. They were very different. When he talked about some wonderful recovery, maybe one person recovered, but 10 died, and he never mentioned these 10 people who died. So somebody said he was the greatest orator of nonsense who could make people believe what he was saying. And the pharmaceutical industry started from there, and they getting a lot of money. They don't want to hear about Deschamps telling people, just stay healthy, stay strong, and you won't have to take all these pharmaceuticals that are making us rich. So what's a trend nowadays? When I was in California, we had more integrative and collaborative practices and clinics where different doctors work together for the benefit of the patient and the client. For instance, I know of a practice where naturopaths hired a medical doctor, chiropractor, psychologist, and massage therapist, and they work together. It's a very good group. So what do we have? We have Western allopathic medicine, osteopathic medicine, regenerative, which is the anti-aging branch, holistic medicine, body, mind, soul, spirit, naturopathic medicine using plants and food, functional medicine, and this one is a new kid on the block. I'll talk about it in a few minutes. It's also important to address psychology and behavioral medicine. Many roots of diseases come from an adverse childhood experience, come from belief, psychology. So we can dig into that and help the person that way. Massagers are also wonderful and very important. So who is that new kid on the block, the functional medicine? Functional medical doctor, they can be medical doctors, they can be chiropractor, osteopath, naturopath. They do extensive testing on hormone imbalance, on what kind of vitamin and minerals you might be deficient, and they regulate your body and get your body to be healthier by balancing everything. And we need both. This is my grandson who had a terrible accident a few years ago. He got hit by a car and flew like 30 feet away. Everything was broken in this poor little kid. He had an open skull, he had broken jaw, broken ribs, broken pelvis. And of course, that's not the place where you say, you should be eating something different, or here is some homeopathic support. We were very happy that the emergency room took good care of him. He was between life and death for 2 days. We didn't know if he could make it. So that's when you need the allopath, Western medicine, to keep you alive. So you have the allopath that are very good for emergencies, medical doctors. We need them for accidents. We need them for fires and to keep people alive. I hear so many people say, I don't want anything to do with medical doctors. Well, we do need medical doctors. We need to learn to work together and know which one we need in certain circumstances. And the naturopath, they talk about lifestyle and nutrition, movement, exercise, nature, mental and emotional trauma, energy therapies. Chronic disease often have a root in a childhood problem. Or even, you go through a divorce or you grieve for something and you don't recover. That will affect your health. Medical doctors have not been trained in that type of therapy, but they're there for emergencies. So if there is a fire, you go to a medical doctor or for testing, or if you need a diagnosis. And if you just don't feel quite well, maybe you need a naturopath that will help you with your lifestyle. So thank you for your attention. If you have questions or comments, you can direct them to me at drd@qhe21.com. It stands for Quantum Health and Excellence for 21st Century Challenges. It also goes to danielledupre.com. That's a little bit shorter. And my website. You have a lot of articles and other webinars on my website. And if you want to, you can subscribe to my newsletter so you don't miss any of my webinar, and you also get a gift. So hope to see you pretty soon for another webinar. Have a great day.